guys, happy Friday. For the Q&A this week, I wanted to do a Q&A spending a little bit more time on all of your questions about oral collagen supplements for anti-aging and for skin benefit and skin health. I touched a little bit about oral collagen supplements in my video on hair, skin, and nail supplements, but I've been getting more and more questions about the different types of collagen, the different types of collagen supplements, and so there's definitely enough information and definitely enough questions to make this its own video, so that is what I'm going to share with you guys today. But if you're not familiar, oral collagen is incredibly popular. And nutrition, we know, plays a key role in the maintenance, integrity, and health of our skin. The use of what's called nutraceuticals or functional foods is a rising trend in skincare and in health in general. Skincare is no exception. Along with technological advances in food science and the food industry, this is turning into a billions of dollars industry. So much so that just in terms of collagen specifically and collagen supplements, in 2016, the collagen market, the market for collagen supplements in the United States was estimated at $3.71 billion that people are spending on collagen supplements. And that's projected to increase, so much so that in 2025, it's expected to be at $6.63 billion. So people are shelling out some cash for collagen. Collagen supplements can originate from a variety of sources. They can come from marine sources, so fish scales. They can come from bovine sources, porcine or pork, so pig-derived collagens. So a variety of animal sources for collagen. You can get collagen in a variety of forms. I think the form that everybody is most familiar with is JELLO. That has been around for a long time, but there are numerous formulations of collagen and collagen broken down in various forms. In today's video, I will get into the differences between JELLO or gelatin and the different types of collagen in supplements and what the relevance of those are. Like any nutritional supplement, there's always reservation to go recommending supplements for any specific condition. And as I said in my hair, skin, and nail videos, the reason for this is that in the United States, there is a complete lack of any oversight and quality control in the supplement industry. So it's very, very hard to objectively recommend a particular supplement given the lack of oversight, as opposed to a prescription medication or an over-the-counter medication. That, and specifically in terms of collagen supplements, there's really very limited, well-controlled, large randomized controlled trials about the role of oral collagen supplements in skin health and skin benefit. But there are some, and there are an increasing number of randomized controlled trials looking at these. So today I'm going to go over those. But before I get into the studies on collagen supplementation for the skin, it's important for you to have some understanding about what collagen is, what it looks like, a little bit about its shape and structure, so that you can understand what I'm talking about when I review the studies. Collagens actually are a family of proteins that are about 28 different human proteins that make up the bulk of the integrity of all of our tissues. Each collagen has a specific role in a specific tissue, and each collagen has its own gene that encodes it. So within your DNA, you have a blueprint for every type of collagen, where it's supposed to go, where it's supposed to be made in the body, and so it's a very important protein. In terms of the skin, collagen is the most abundant component of the bulk of the skin, what's called the extracellular matrix. What makes up the meat of our skin is by and large collagen. 75% of the dry weight of our total skin is in fact collagen. And the quality of that collagen, not only the quality, but also the quantity, the amount of it, begins to decline steadily and slowly as a result of age. Age-related decline in both quality and quantity of skin collagen contributes to the visible signs of aging: wrinkle formation, discoloration, dry skin, increased transepidermal water loss. In order to help you visualize what collagen looks like and what it is made up of, I want you to imagine a string of beads. Collagen consists of coils of strings of beads together, and that is what makes up its shape. And that shape allows it to perform the functions of constituting the bulk of tissue integrity. So I'll come back to the beads in a moment when I talk about the studies, but hopefully that helps to give you a visual understanding of what collagen looks like, its shape, and this will be important for you to have a better understanding of collagen supplements rather than just hearing the word collagen and not really knowing anything about it. But native animal collagen, as I talked about at the beginning of the video, can be derived from pig, it can be derived from bovine sources or marine sources, and it can be extracted from the connective tissue of these animal sources in a variety of ways and manipulated in a variety of ways. Probably the most commonly used way, and the one that we are all familiar with, I think, is gelatin. Gelatin is made simply by heating up collagen, and what that does is it kind of messes up that complicated, neat little coil that I talked about early, and it messes it up in such a way that it forms a gel. It gels out, and that's desirable in food and food science and cosmetic preparations, as gelatin can be added as a thickener and it will form a solid when cooled back to room temperature. But that heated up collagen that has denatured and kind of fallen apart as a result of heating, it can be further processed for the use in supplements. It can be further processed by putting it in an enzyme that will digest it. So in order for you to understand this, I want you to come back to that chain of beads again. If you imagine the chain of beads and you imagine a pair of scissors, the scissors are your enzyme, and the enzyme is going to cut up your chain of beads into now more chains of beads that are shorter. So the beads are just various lengths, but understandably, they are all shorter than the initial starting length. That is what is referred to as collagen hydrolysate. Collagen hydrolysate is nice for inclusion in supplements and of interest because it has a lower weight than gelatin. Gelatin is just that big, bulky protein that is all melty. And so because they are more lightweight, they're also more easily dissolved in water. And unlike the gelatin, they don't gel at room temperature when brought to room temperature. So they will go into liquids without solidifying things. And therefore they can be added to drinks, they can be added to supplements. So all of those little snipped up pieces can be further processed and further degraded into what is referred to as bioactive peptides. And bioactive peptides are different in that they are the shorter chains, but they are restricted to 2 or 3 beads. All right, so they're either going to contain 2 beads or 3 beads. That's all you need to understand. The reason this is important is we have some studies of bioavailability of these different forms of collagen, and we have studies in humans that show that collagen dipeptides, meaning the 2 beads, and collagen tripeptides, the 3 bead chains, they become readily available and are absorbed in the digestive tract and can be detected in the bloodstream after oral consumption. We also have some mouse studies showing that when mice are given collagen dipeptides, collagen tripeptides, the 2 bead, 3 beads, when they are given those orally to ingest, that those peptides then show up in the skin of those mice and stay there for about 2 weeks. We don't have any similar studies in humans showing how long orally consumed collagen peptides stay in the skin, but mouse studies show they stay there for 2 weeks. While we don't have a ton of well-controlled studies looking at oral collagen supplement for benefits in the skin, we do have some. And we probably have the greatest number of studies for collagen hydrolysates. We have 8 studies looking at doses of collagen hydrolysates anywhere from 2.5 grams per day to 10 grams per day. And the durations of all of these studies vary anywhere from 8 weeks to 24 weeks of daily consumption. One study looked at 106 women, ages 40 to 65, taking 10 grams per day of collagen hydrolysate. So in this study, women taking 10 grams per day of collagen hydrolysate, they showed at the end of the study, at the end of the 12 weeks, they showed 8.83% increase in collagen density in their skin in comparison to placebo. Placebo had 0% increase in the collagen density in their skin. And they also had a decrease in broken up, disrupted collagen in their skin, decreased by 31.2%. Whereas controls who were receiving a placebo pill or just a sugar pill and no collagen, they actually had an increase in fragmented, disrupted collagen in their skin. There was another study of 120 patients ages 40 to 60 years of age who took a supplement that was a combination of 5 grams of fish collagen hydrolysate in combination with, it also had borage, glucosamine, and a variety of antioxidants. And those individuals had an increase in skin elasticity by 7.5% at the end of the study in comparison to controls. There are also other studies showing improvement in dry skin on the forearms of individuals with dry skin after 4 and 8 weeks of marine collagen supplementation, either at 5 grams per day or 2.5 grams per day. We also have another study of 33 Japanese women who took 10 grams of fish collagen hydrolysate per day for 8 weeks, and they showed a 12% increase in skin hydration. Interestingly, though, they also looked at another subgroup of individuals taking 10 grams per day of pork-derived collagen supplementation, and they actually had even greater improvement in skin hydration compared to those taking the fish. However, in both groups, there was no difference in what's called transepidermal water loss, just in this study, however. We also have a study looking at 114 women who took collagen supplements at 2.5 grams per day for 8 weeks. This was a study looking at collagen hydrolysate for anti-aging purposes. And those individuals had an improvement in the appearance of eye wrinkles. They had fewer eye wrinkles at the end of the 8-week study. They had increase in what's called procollagen 1 in their skin, so a type of collagen present in the skin. They had an increased amount of that, and they also had an increased amount of another structural protein in the skin called elastin. Believe it or not, there's actually a study looking at collagen hydrolysate for the improvement of the appearance of cellulite. There are very few things out there that seem to improve cellulite, but we have one study looking at collagen hydrolysate, specifically taking 2.5 grams per day of porcine or pig-derived collagen hydrolysate for 180 days, resulted in an improvement in the overall density and thickness of the skin in people with cellulite in the areas of cellulite. So that correlates with an improvement in appearance and the way the cellulite looks. But interestingly, those who showed an improvement and a sustained improvement, at least in the appearance of their cellulite, were only those individuals with a body mass index or BMI less than 25. Individuals who had a greater body mass index showed no improvement with collagen supplementation. And we don't know, does that have anything to do with the biology of the cellulite being different, anything different as far as metabolic factors that might be influencing that? Or was the dose of the collagen supplementation something that should have been administered on a per weight basis, and so that those individuals at higher BMIs may have seen an effect if a higher dose was given based on if they were getting a weight-based dosing. Does that make sense? So this was not weight-based dosing, so that could potentially explain the discrepancy. So those are the studies that we have with collagen hydrolysate, which I'll remind you is taking that chain of beads, cutting it up into shorter chains of beads of varying lengths. We have two studies looking specifically at collagen tripeptides. So those are 3-bead chains only. The 3-bead chains only, or collagen tripeptides, we have 2 randomized control trials. A total of 40 patients in both of the trials, and in these trials, the patients took 3 grams per day. All right, and so in one of the trials, they took 3 grams per day for 4 weeks in the first trial. And in the first trial, the patients were specifically undergoing a cosmetic procedure that I've talked about on here before called fractional photothermolysis, or Fraxel. And what was interesting is that those who supplemented their Fraxel treatment with 3 grams per day of collagen tripeptides, they actually had a better outcome from their treatment than those who just had the treatment without the supplementation. And by better outcome, they had a significant improvement in overall skin hydration, elasticity, as well as a decrease in transepidermal water loss in comparison to placebo, who just had the laser procedure alone. And then the other randomized controlled trial looking at 3-bead chain collagen tripeptides is one in which individuals took 3 grams per day along with oral vitamin C for 12 weeks. These were 32 otherwise healthy people. I will also point that out. They had no other medical issues. And they showed at the end of the study an improvement in skin hydration, an improvement in elasticity, and a decrease in transepidermal water loss. This study, however, only looked at consumption of collagen tripeptides with vitamin C and consumption of collagen tripeptides without vitamin C. So those were the 2 groups being compared. And while there was an improvement in both groups of skin hydration and elasticity, there was no difference with the addition of vitamin C. So suggesting that vitamin C doesn't really add anything, at least in this small study of 32 otherwise healthy people. We have one randomized control trial of collagen dipeptides that looked at 85 women ages 25 to 57, so quite a spectrum of ages. For 8 weeks. And what's interesting is in this study, they actually looked at some different concentrations of collagen dipeptides, and they showed that at the end of the study, people who consume collagen dipeptides had an improvement in some of the visible signs of aging. They had an improvement in hydration. They had overall smoother skin, and they also had decreased depth. They measured the depth of wrinkles, and the wrinkle depth was less, which you can see when hydration in the skin and moisture is improved and transepidermal water loss is improved. You will see a decrease in wrinkle depth just by space filling, and they showed that objectively. Interestingly, though, the lower the concentration of the collagen dipeptide, the less of an effect, and at very low concentrations, there was no effect. So this is interesting in that it suggests that not only is it potentially the type of collagen, but also the concentration. We don't know what the effective concentration is going to be to get these outcomes. One of the things I think is most reassuring about all of the studies that I've talked about today and all the studies that we have is that there have been no adverse events reported in the studies. Of the 8 randomized controlled trials, there have been no adverse outcomes. So it suggests that over-the-counter oral collagen supplements seem to be safe. Again, I say that seem to be safe because a problem with the supplement industry is that they're not regulated, and frequently so they're not regulated. There's no standardization as to dose or the different type of collagen that's going into it. But also supplements will add other things in, other vitamins, minerals, sometimes hyaluronic acid, and so the contribution of those things to outcomes is still poorly understood, and so there's just too many variables going on across the market that are not regulated, standardized, or controlled in any manner. So, in conclusion, it's a controversial topic, and one that's challenging for dermatologists, for physicians to discuss with patients, because it seems promising and it's encouraging to see that we're not seeing any adverse outcomes reported. But given the lack of large-scale randomized controlled trials, I think people will often come in with very unrealistic expectations as to what oral collagen supplementation can offer. And to suffice it to say, we simply don't have that robust of data to go recommending these, not only for any specific condition, but also the dose. We don't know what the optimal dose is, the optimal type. And so there are a lot of unanswered questions as far as things go. But one thing that seems to hold true amongst all of the collagen studies that I talked about today is that subjects report an improvement in quality of life. So those things, improved quality of life, no adverse effects reported, seems promising. It's one of those things where the physician's probably kind of left saying, well, yeah, we feel like it's probably okay, but be aware it's not super well studied and not well controlled. So it's hard to have a conversation about it, to be frank. In dermatology, it's an exciting area of research. It holds a lot of promise for people with eczema and skin diseases where there is an impaired skin barrier. Perhaps in the future, one day we might see oral collagen supplementation replacing some of the standard eczema therapies. But we are nowhere near there yet whatsoever, and this would not be recommended for people with eczema as a treatment, okay? But exciting to think that perhaps in the future it might offer those individuals some benefit. We also still don't have answers as to normal human skin turnover of collagen. In rats, we know that the half-life of collagen is 74 days. So, you are not a rat. It's really hard to say, like, how frequently should oral collagen supplements be dosed. So that's a challenge. That's a gap in knowledge. Something that we're really left shrugging our shoulders with as far as counseling. And then again, I mentioned the optimal dose. Who knows? There's variability. Suggests, the dipeptides, perhaps higher is better, but we really don't know. So hard to counsel. And not all supplements are created equal. As I said, lack of regulation, lack of oversight, lack of quality control. The concentrations of collagen dipeptides and tripeptides is going to vary and from supplement to supplement, and there's no way to objectively know for sure what you're getting in any of them. And then lastly, we don't know who's going to benefit the most from this. So when people say, are collagen supplements good? Are they beneficial? Do they help? Like what specifically? We don't know. We don't have, I'm sure they're going to help some people and they're not going to help other people. And so it's really hard to counsel in that way because the people that are not going to help are going to end up wasting their money. And clearly this is a billion-dollar industry out there that people are spending a lot of money on. And so from the medical perspective, it's really, really take a step back from pushing this kind of thing because there are likely people out there who are not going to see any difference with collagen supplements. So why would we go recommending something expensive that's not evidence-based? It may not even work for you. It's really hard. Hopefully this Q&A was helpful to you guys in answering your questions about collagen supplements. Please don't ask me to recommend one. I can't based on what I just told you. They're all over the place. I have no intention of consuming them as a vegan. I'm not interested. So hopefully this video gives you some evidence-based discussion, and I'll update the video in the future if new studies come out. I'm happy to do that, but I do not plan to review collagen supplements on here. I don't think it makes sense given what I told you. But anyways, guys, if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.